Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is Alt Psych. Are you banging on my cage?
Is this thing on?
Testes, testes. 1, 2, 3.
Wow. Is that your radio voice?
It's my Casey Kasem voice. Oh, wait, that didn't sound like Casey Kasem at all.
Yeah, well, good. You don't get paid for, doing impersonations. So there you go.
Luckily. What's our mental wealth tip of the day? Let's kick it off.
Our mental wealth tip of the day is, hey, Mark, how you doing today?
Well, I'm glad you brought that up.
It's always weird when a shrink asks you that, so don't answer it directly. The mental wealth tip of the day is, no matter how intelligent your child is, and they may be very intelligent, it's most likely their emotional development is not nearly as advanced, so don't expect them to act like an adult, even if they're smart.
I like it. That hits close to home. It reminds me of my oldest brother, who was a freakish monster by the time he was like 12 years old.
Reminds me of me. They used to call me the midget because when I was little, I could talk like an adult, but emotionally couldn't find my butt with both hands in a mat. But, that's why therapy was invented.
I mean, I think the way around it is when I'm talking to a kid, I consciously remind myself of their age, or I at least pay attention. Am I talking to this person the way I should be talking to a 12-year-old or a 15-year-old, and not either, my kids are little, so sometimes I underestimate how much they know. And then, my nephews or someone else, I might overestimate and realize, yeah, this kid's an 18-year-old body, but in a 12, 14-year-old or 18-year-old mind in a 12, 14-year-old body.
Which brings us to today's
topic. I'm saying? Actually. I said that backwards.
No, you had it good. It brings us to today's topic.
Which is a great topic, right? It's multiple personality and dissociative disorders. I'm not sure we plugged it, but that's a fun one.
Well, they changed that multiple personality thing in the diagnostic manual.
Yeah, so that was clickbait. The preferred nomenclature is dissociative identity disorder, or DID. But, a lot of people still refer to the colloquial, or previously known as, the artist formerly known as Prince, or multiple personality disorder. This is your bag, baby. This is your area of expertise. So I'm just going to interview you. Can you just talk for an hour?
Okay.
I'll come back.
Well, I think probably the most important thing is that it is a real thing. It's a real event.
Yeah. That's one of our myths, right? We were going to.
And I actually don't think it's as prevalent as some people think it is, but it's real. And there's a diagnostic criteria for it, but in the real-time processing with patients, some patients have like tons of symptoms of it and may leave one thing out. You still have to treat it more or less the same way. It's sort of post-traumatic stress on steroids.
Well, it certainly is that. I mean, I think the average number that comes out is about 1.5% of the population has criteria on. Do you think it's safe to think of it as sort of a spectrum, the DID spectrum? I mean,
I personally like to think of it that way. I don't think that the diagnostic manual would agree with me, but to me, it's not like being a little bit pregnant. I mean, people have varying degrees of whether they dissociate, and they'll have parts of themselves that they call them alters in the literature. I kind of like self parts better. Alter sounds too much like this,
alter sounds like alter ego to me. Like
I guess
like
it could be an alter like you pray to or something. But I've had cases where they were certainly split off. The core personality had no awareness, but they didn't have names or particular jobs, and then there were others where each personality had a specific role in what this one woman called the network. She called it the network.
So it's more well-defined kind of thing, discrete.
Yeah, I mean, I worked in a hospital then where they had animals. The kids would raise animals, and they had a farm, and they had a garden. And there was one. This was to me amazing. This one personality who I met fairly late in the game. She only would take on the horrible odors of the trauma. She would literally only had the facility to smell things, and being sort of the eccentric genius that I have to be to survive, I said to her, "Have you ever smelled a flower?" She said no, and she described the odors that she was used to smelling. And I said, "Come with me." And we went to the garden, and I brought her to each of the different flowers, and I saved the rose for last. And when she smelled the rose, she started weeping, and she said, "I didn't know I could have the experience of such great beauty." So I popped off one of the flowers. I handed it to her. "Here's your homework. Every day on your way home, go to a florist and buy one rose. And every day for the next 30 days, I want you to buy a rose so you know you can have this."
Did you tell her to stop and smell the roses?
Actually, no, I didn't have that cliche down at that
Oh
point.
man, she teed that up for you.
Yeah, it was a good one. If I wish I had known you then, I would have said something.
So
but I would have credited you, by the way.
What if one of the alters is an altar boy? Then you refer it to as the altar boy?
I guess you would. And you know, as luck would have it, I bet you there are a lot of altar boys that experience this because it does come out of very serious early trauma. I mean, it's a myth that this thing can start late in life. In my experience, I mean, the books say it can start between 6 and 9. I've never seen a real one that started after 6.
Yeah, I mean, it's interesting. They kind of have similar diagnostic criteria for ADHD.
Yeah, well, you know,
but people ignore that.
Everything looks like a nail at some point, you know.
Yeah, but I mean the true definition. I mean that we were pouring through the DSM because I think my training and interpretation of the DSM were slightly off here for reasons I can't totally figure out why. Because I liked my training, I thought I had good training, but you know the definition of DID is essentially it's a mental disorder, meaning it causes some disruption in function and social or occupational impairment, that type of thing. But you got to have at least 2 distinct and relatively enduring personality states. And then, like you said, got to start early. I was taught that what made it different from other dissociative disorders was the awareness. And you've reminded me that although that's maybe true in the beginning, it was absolutely necessary for the treatment and healing is the integration of those parts and the awareness of them. And I thought your screening tool was pretty brilliant about asking if they have periods of lost time, because the disorder is always accompanied by memory gaps beyond what would be explained by ordinary forgetfulness.
Yeah, the other good question, if you're a clinician out there and you're thinking this might be the case, is just ask them if they were ever called by another name that they didn't know. And in my experience, they look at you like, yeah, that's pretty weird, isn't it? But the time one is really diagnostic. They have to, and I don't even know if it's in the diagnostic criteria, but in my experience, the other thing as a therapist, the first one that I ever knew, he's the man.
Let me fact check this show. I'm going to fact check this show.
Well, it's interesting what happened with the first real one that, I mean, because sometimes people claim to have multiple personalities, but there are some, you know, some tells that they're not.
Yeah, that's what I'm interested in, the tells. Tell me about the tells.
Well, they actually have to dissociate. And there, you know, what I saw with people is, because it's dissociative identity disorder, not just identity disorder. Look, before I go there, you know, you study somebody like Carl Jung, and he basically says we're a collection of self parts, and the goal is individuation, becoming a single individual in, you know, in your experience of life. Well, okay. So if you think about it, maybe we're all multiple personalities, but we don't meet the criteria for dissociative identity disorder because you actually have to dissociate to experience that.
Well, that's
to meet that criteria. And you know, the fact that I have different parts of myself, I don't really usually dissociate. What I've
Well,
seen
it's because you're integrated, correct?
more. I'm not, the individuation piece is beyond just integrated like an ordinary personality. Jung is talking about a spiritual event, I believe. But the bottom line is you watch somebody and if they're a real multiple and they hit some anxiety, they will roll their eyes all the way. I can't even do it. I can do it a little bit.
It looks
They'll roll
pretty
their eyes,
creepy.
so you basically will see like their eyes will flutter like they're in a dream state, and they'll roll their eyes back and you will see some difference. Now, I found it fascinating, and who knows? But some of the things that I saw with some of the people that I've talked to on this, they will react. The different alters will react differently to different medications. They'll have different eyeglass prescriptions. In fact, one time we were ending the session, and this woman got up and she tripped, and I caught her before she hit the floor, and she said, "That damn Jason, his feet are so big." I went, "I don't want to know." Her idea, I mean, it was like a shock to me, was that she left, he was out, and he has big feet, so she wore bigger shoes. Now she's wearing, her feet are too small for these shoes. Now, I didn't check her feet. I was just,
I think it's the rug in your room. It wrinkles up easily.
Yeah, it might have been, but it wasn't this room, of course. But I'll check it for the next one.
The nicely directed.
It was an amazing journey. I mean, and quite an educational one. I think I learned more about human consciousness from that first DID patient than I learned anywhere else in my travels.
Well, I learned a lot from, obviously patients, but medical students in terms of what their understanding is of psychiatric stuff. We've talked about common misconceptions on this show before, mainly what depression is misconstrued as, what PTSD is, but specifically, I think we mentioned schizophrenia and kind of how a lot of people think schizophrenia is actually closer to dissociative identity disorder. I'm schizophrenic and so am I misnomer. Yeah. But in doing the research I was for one of our future shows on Monarch programming and MK Ultra, I ran across a ton of these videos of mostly celebrities and famous people looking like they are switching to an alter. Matter of fact, the only one I didn't want to put any on here because I never know how close we are being kicked off YouTube, but there is one with Britney Spears, which I think is pretty classic, and at least in what I've witnessed clinically of the switching to alters. But it was just funny. I was looking up MK Ultra and mind control because that's how bizarre it looks. To see someone, to not be familiar with this, to see someone who you think like we all think we know Britney Spears, like we can at home. Who knows what Britney Spears is really like? She's a celebrity. She may not even know what she's really like. However, there is some interesting videos out there you can search and find looking for switches. And the Britney Spears one was one that stuck out in my mind. When
I first encountered this was the early 90s, and we didn't quite have actually it was late 80s, 89, 90, something like that. Anyway, and there was this one scene that I'll just never forget. The woman's daughter calls me up because nobody had cell phones then. The old days were, before they changed the air and the water and we were all horse buggies and stuff. She calls me up and she says, "I don't know what to do," because I gave them my home number because I knew that I needed to respond quickly. She says, "I don't know what to do. Mommy's got a knife and she and daddy are wrestling on the ground and, I'm scared." And I said, "Can you get the phone to your father?" And he goes, a British guy. He goes, "Richard, she's got the knife. She's got the knife, Richard." I said, "John, you're 20 times stronger than her. Take the knife away from her." And then when she got on the phone, I said, "Get the phone near her." And I said, "Do you know who I am?" And she said, "You're one of," and she laced with a few obscenities, but basically identified me as that I was a member of the cult that had horribly, horribly mistreated her. And I said, "Well, actually, you're wrong." And I actually was able to get her into a hypnotic trance. I said, "The problem is that you're remembering something and you're acting like it's happening now." Mm-hmm. And I said, no one can remember every minute of every hour. I went through a whole thing. After a couple of minutes, she said, why am I talking to you, Richard? I said, well, you had a rough day. We'll talk about it tomorrow. Now, the interesting thing for this gal was that she had been given, and I don't know that this was any, what this was, but I had read about it, a program that if any therapist had discovered the multiplicity, she was to make a public suicide to discredit the therapist. So when I confronted this, I lived on the third. My office was on the third floor. I guess I kind of lived there then. Well, she went for the window. It was the best tackle I ever made in my life. She was going out the window, and I tackled her. And fortunately, there was a phone nearby, and I managed to dial 911. Well, when the police officer arrived, she saw him. She went absolutely out of her mind. He was a big guy, about 6'3", big, strong guy. And it took both of us everything we had to keep her, because her energy went off the scale. She was going to complete that program.
Well, and your experience, well, not your experience, but this, that 90% of the cases are associated with childhood abuse and trauma. Some are linked to war. I think about these little kids growing up in Iraq and stuff like that, with this constant faceless enemy of drone strikes, and death from afar with it, no warning or ability to retaliate. If you grow up in that, especially in the formative years, I would think that you would see a higher prevalence of DID, or sometimes really botched medical procedures in childhood can trigger it. But how many of the
I'm sure that if we set up practice in Iraq, we would find it. I don't find that here so much. To me, it's almost invariably serious either cult activity, horrifying sexual abuse, physical abuse. But it's combined with the physical stuff. There's a mental piece that is absolutely devastating. And what the idea is, these things are being done intentionally to kids sometimes too. So what they'll do is they'll take a piece of paper and they'll go, well, what color is this? The kid will say white. They'll whack him and say it's black.
Yeah.
And again, what color is this? They'll say white. Kid says white. They whack him. They do it a bunch of times. What color? Exactly. Say, what color is this? The kid says black. They whack him. Why are you lying?
I knew you would get that reference.
Oh, yes. That's right, Captain.
There's 4 lights.
Well, but it's, if you think of it,
over 6.
It's almost as if there's a torture aspect that creates a mind control. I actually heard a quote from Jesse Ventura, who was talking about waterboarding, and said, well, you give me an hour with Dick Cheney in a waterboard, I'll have him confessing to the Tate LaBianca murders. Mm-hmm. The issue here is he may confess, but you're not going to get the fragmentation that we get when it's before the personality is developed.
Right.
The personality develops as it develops. There's a sequence to it, much like, kids will, they'll crawl before, most of them anyway, crawl before they walk and walk before they run. There's a developmental sequence psychologically as well. And at certain points, I don't think you can fragment the personality. You can create tremendous trauma and create dissociation, but it's all the same personality.
Well, so going back to our point about the spectrum and kind of transitioning into dissociative disorders outside of DID proper, let's compare and contrast a little bit about the DSM specifically delineates, depersonalization and derealization disorder, which, honestly, I had kind of forgotten that they were listed separately, because it almost seems like a subset to me, because depersonalization and derealization can occur in all kinds of different contexts, many of which we've already talked about on the show. It certainly can be a feature of DID, but as a discrete disorder, in theory, it's separate, meaning not meeting all the features or the diagnostic criteria for DID. Do you think people who you would see that met the criteria for that disorder are easier to treat, heal, approach? In other words, is DID more severe than depersonalization disorder, or
I
maybe
would,
we
I
should.
would, I would say yes, only because the depth of the fragmentation is deeper. The need to break through whatever those inner walls are to help the different self parts get acquainted with each other, share the memories, and be able to deal with life as a single human being. I mean, as I said to one of them, listen, if one of you gets a speeding ticket, you're all paying for it. Because that's the way. We don't sort of give people a pass because they dissociate. Oh, that wasn't me. That was Roger doing that. No, no, no. Tell Roger he better cut it out because you're going to get punished for it.
It worked for Oscar Pistorius, I think.
Somewhat. Oh, well, yeah, but that's true now that you mention
But
it.
the reverse is also true.
I don't know if people know who that is, but
anyway, I think he's still. Yeah. Oh, he got off. I think. I don't know.
I think he got some kind of reduced sentence.
But the opposite is also true, because when one of the at least for me personally, when I learned about Gestalt psychotherapy, I was the most excited about that, and then that was my own projection because it was feeding a need in me that it was just a better fit for me, and I was really more intrigued by it. And then, of course, one of the classic techniques is the empty stage type of experiment, or maybe an experiment's not the right way. The empty stage.
It's an exercise.
Exercise. Thank you. That where you're actually doing the opposite, right? You're taking an integrated adult and you're actually going out of your way to fractionate them and say, hey, you know what? We got the little boy, we got the critic, we got the.
Well, I have this guy here.
Let's turn the knob up, or in this case, let's turn the knob down.
I have this guy here to remind me. This is not Colonel Sanders. That's Dr. Freud. Dr. Freud, who I don't agree with most of his. You have one too, don't you?
Yeah, but he's over here.
Oh, he's all over there. He's on the bench. Freud said that the goal. Oh, I think Mark is getting. We have Dr. Freud. Dr. Freud. He said the goal was to make the unconscious conscious, and
mine has a cigar.
Is it just a cigar?
Sometimes, Rich, a cigar is just a cigar.
Yes, I see. I was trying to find one of Jung, but they didn't have them, or they used to, and they don't have them anymore. So anyway, the idea is to make the unconscious conscious, and I think what we're doing in treating dissociative identity disorder, it's a lot harder because there's so much trauma on board, and the way that these memories are encoded. Yes. And it's part of the reason that Freud, he should have had a body therapist helping him.
Have you noticed that his shoes are on backwards? And was that on purpose?
Actually, mine are on right.
Really?
But I don't think they had Nikes. Oh, yeah, they are backwards. Son of a gun.
Yeah.
They didn't have Nikes back in Vienna, I don't think, in the 19...
I'm going to return him back to the masturbatorium, see if he can get that straightened out.
Thank you very much. He'll appreciate that.
Give him some alone time.
You asked me if they're harder to treat, and the answer is probably yes. And the other thing is, it's one of the reasons I developed that emotional shifting process of working with the body therapist, because there's usually a body insult on for these kind of patients. It isn't usually just, they ran out of French fries at McDonald's and somebody got upset. This is usually a very serious threat. The other things, psychological threats, they will play act and say, well, you killed this animal, you killed this baby, or who knows, maybe they even do that. I don't know. The patient that I learned the most about this from, I used to get finger paints and have the inner children do finger paints, on the floor. And I'm really not 100%. What's that? Yeah, because they were little kids and they wanted to finger paint, and they would tell me stories in the finger paints. When these kind of things happen, you really got to be creative as a psychotherapist, because telling people to cut it out just doesn't usually work.
Right.
And I remember that my first awareness of this patient had been seeing a therapist for 5 years and wasn't getting anywhere. He referred her to me, and it was about 8 sessions in, I realized that she was telling me the same story again and again and again with affect-like she was telling it for the first time. And I tried to confront it sort of on the side. And I said, do you feel like I'm not listening to you? She says, no, you're listening to me carefully. And I said, well, you've told me this story like 4 or 5 times now. And then it like hit me what was going on. And I said, did you ever feel fragmented? And then we were off to the races. And she literally started switching like every 10, 15 seconds and rolling her eyes and shaking. And it was pretty wild. And then I had to make a map of what was going on internally. It took quite an amount of time. In the end, to me, it was a spiritual event. She did integrate. That it was really more of a spiritual event. That no one is a good enough psychotherapist to cause the integration without some other help. And the psychiatrist that was treating her at the time, this was out in California, he started going off on me that, what a great therapist I was. And I said, listen, man, I'm not modest. That wasn't me.
It was the Haldol.
Well, it would have been nice, but you know what? The one part of her liked the Haldol, the other hated it. They tried everything on this gal.
The other one was allergic to it, huh?
I guess. Well, she would give me the report. Well, Jennifer and Jessica liked the Prozac, but Janine likes Haldol. And I would get, it was like, huh?
Well, going back to depersonalization and derealization, that's one of the diagnostic criteria for panic disorder or a veridical panic attack versus an anxiety attack, which a lot of people don't know the difference. But you do get depersonalization and derealization during a panic attack frequently. Some people will describe it as my vision went weird or tunnel vision. Yes. But if you dig in deeper, they're talking about derealization, the world outside of them becoming, right, foreign, fake, artificial versus their inner scape, which is the depersonalization.
And it's interesting you bring that up because I remember.
I know.
Well, because you're always interesting to me, but what?
No, it's because it says it here on the cards.
Okay, good. I remember when this woman was about to go out the window, when we corralled her, and I said, do you know who I am? And she said, well, all I can see is your eyes. I can't see anything but your eyes. But, everything else is black. So that confirms, anecdotally at least, the ideas that maybe the people writing up these things know a little bit. The other thing was there was some very, very odd physiological effects. This woman, and if I hadn't seen the test results, I wouldn't have believed it. She had been HIV positive for quite some time. After the integration, she spontaneously went HIV negative. And I don't know that that's in the literature anywhere, but I saw it. So it was pretty wild. It was sort of, it was my education, my postgraduate education as a therapist was this woman, sort of looking at an exploration of human consciousness that I had, only dreamed of before.
What about, have you ever seen an alter that speaks another language that they shouldn't know? Kind of like with children who seem to remember past lives and know locations.
Once.
Because DSM don't explain that.
No, it doesn't. And this woman just started speaking German, and I said, well, did you ever, speak it before? And she said, no. Did anyone in your house speak it? No.
And she's
many odd, very odd events. It seems in my experience that the people that I think were genuine DID were incredibly intelligent, but also amazingly intuitive. And I don't know what that is exactly, but the one back in California, 3 nights in a row, she has my dreams. And I was like, this is really crazy. So she said, well, I had a dream last night. I said, wait a minute. I wrote it on the pad. And she started talking about the dream. I turned the pad over. It was the exact same dream. So who knows what that was? I mean, I don't really know. All I can tell you is that I just had to really get in a frame of mind where I wasn't going to be scared of it because she could pick up on me being afraid. And it, you know, for a therapist who doesn't know about these things, it is a little scary. You don't know what to do.
Google the Britney Spears one, and I wish I could remember a lot of these other. Like, you know, one was a famous basketball player, which I mean, I know basketball's a round ball, but I don't. I'm not really that great with the sports. I think they call it football and other. I'm not really sure. I can't back that up, but it is alarming to see and to witness. And depersonalization,
Hockey,
derealization.
hockey's the
Oh,
sport. Yep, right, Captain.
yeah.
It's
Uh,
Toys Day today, I guess. You know, we have Freud and Steven Stamkos here today.
I'm
I guess
sure.
that's the multiple personality stuff.
Uh,
Um,
I have some other stuff.
the thing about this is a lot of this stuff is counterintuitive in that you would think that you could just say, hey, you're pretty fragmented. How about everybody coming out here and we'll talk about it? That'll make them run away faster. It's
Yeah,
really about a relationship where some of the pieces are starting to pieces, some of the alters, the self parts, in my opinion, are starting to see that you're okay. They're checking you out from the inside. It's a very uncanny experience to feel like someone's talking to you and yet another part of them is watching you at the same time to see
Hmm.
your reaction.
Well, and there's some overlap when we were talking about. It's like a Venn diagram. If you got DID, which I guess we're saying is the extreme end of something else, and then the depersonalization, derealization, which may occur in DID, but it can also occur in panic disorder as a hallmark diagnostic feature of it. Actually, in the middle, you've got it as its own standalone disorder, which again, like my grandma would say, it's pick and fly shit out of pepper a little bit. But I think
I
it's an
like that.
important distinction because you can have dissociative amnesia, I mean, which is a common feature of an acute stress reaction, right? Or even PTSD. It's one of the diagnostic criteria is an inability to recall important aspects of the trauma. Or we've talked about time dilation, when the brakes lock and you're sliding towards the big truck, and I could continue the rest of the Pink Floyd song there, but you stretch the frozen moments with your fear, and you never.
Well, it does occur to me that Pink Floyd has had some experience with these kind of things. Um, the key, I think, is that dissociation, like they say, thunder only happens when it's raining. Well, dissociation only happens when it's anxiety time,
Yeah,
heavy anxiety.
or you get the dissociative trance, like some of in the research for the MK Ultra, to to the different parts of me, I'm like, holy cow, that looks like dissociative fugue or dissociative trance, which I wasn't going to talk about dissociative fugue today, but that's the when Walter White takes off his clothes and wanders into a quickie mark, and he's pretending he has dissociative fugue. Can't remember important anything really about the last 2 or 3 days. It's a classic theme for soap operas. It seems to happen like every show. But the dissociative amnesia is important. Not only just PTSD, but it's that inability to access it. It's part of the fragmentation, really. And a lot of times little kids will dissociate, but they don't necessarily have any alters.
Yeah.
They may not even have the depersonalization, derealization. It's almost like a severe repression of that trauma itself.
Well, it's clear to me that by the name of the disorder, and I often hesitate to say it's a disorder because it's actually an incredibly sophisticated and elegant defensive structure to preserve a person's sanity. Going through really horrific things
in their life.
Without much ability to process emotionally as a very young person. It's an amazing event that prevents people from going crazy, but they pay for it later. That's how I see it. And for me, I'm not real good with black and white stuff. So the continuum of dissociative disorders, where dissociative identity disorder is the high end, and maybe you're just kind of zoning out because you don't like the lecture is the low end
Wait,
of
what were we
this.
talking about?
Excuse me?
What were we talking about? I zoned out.
I guess I must be mildly uninteresting to you today because you zoned out. No, I didn't see it. You just thought you zoned out.
There's only two other things in the DSM that it talks about on that spectrum, and that's what I call the trash can ones: the other specified dissociative disorder, which doesn't meet criteria for anything else that we've talked about, and the unspecified dissociative disorder, which is slightly different but another version of the trash can. But the treatment, I mean, you're the expert here. I'm just a guy. My name's Larry. But the treatment is very similar for all of these dissociative disorders. It
Yeah,
involves
it's
reintegration.
it's making, in my opinion, you have to go beyond cognitive behavioral stuff. You have to make the unconscious conscious. Now, I tend to work with body therapists. I use all kinds of, different trauma techniques, eye movement. Um, I used to use the tapping. I somehow it felt invasive to me, so I kind of stopped that. And there is just, a place where people will hit their stuff and they'll have emotional releases and it'll start to dissolve. I think of it not as releasing things, but dissolving blockages. That
Yep.
there are structures that keep people safe, but you see, they are safe, so they don't need the structure. They just don't know that at an emotional level.
Well, you're facilitating the impasse,
Yeah.
and dare I say, you're a master in that department. And I
Well,
think,
I appreciate that. I got just between me and the wall. I mean, it's hard work, and you really have to be on your toes. And I'm training some people to do the mind body stuff now. We're really excited about. I want people to do this because I worked with vets. Let's say they weren't dissociative identity disorders. At least I didn't think so, but their post traumatic stress was so high from the war that just talking to him made him worse. We've talked about this.
yeah, scratching at the scab.
Yeah, with DID, with dissociative identity disorder, we need even more power in the therapy to break through a lifetime of fragmentation that, in a kind of a weird way, works to reduce anxiety. Well, here's the part of me that takes care of the kids. Here's the part that takes the bad odors.
Yeah.
Here's the part that has sex with my husband. And I mean, and they're very specified. It was fascinating. The gal in California had 40 discrete altars. And the way that they joined up was almost in a pattern as we work towards individuation. But in the end, to me, the individuation was a spiritual moment that when, and it really had to do a lot with letting go of tremendous negativity and then replacing it with a sense of God, of unity. It was beautiful. It was quite a privilege to be a part of it.
Well, it's good work, and I think a lot of people don't know what it is. They don't know what to do about it, and they certainly don't know where to find a competent practitioner that has the capacity to not only heal them, but most importantly, not make them worse, which is one of those areas where we really can do harm. So I love that you do it. I tell everyone about you and about this part of it because I think it's way under recognized and underappreciated and much more common, like we said, of 1.5%. I mean, look at even Britney Spears maybe have something going on. It's either that or MK Ultra, absence seizures, or maybe she's just trying to do some clickbait stuff.
Well, we talk about, what's going to be the metaphor for the next decade. There's no doubt in my mind it's going to be trauma. And just the extent of what that trauma is, every single person in this country and maybe all over the world is experiencing something that would qualify for post-traumatic stress. If you go into they've either witnessed or known somebody who's had a death or a near-death experience. We're watching numbers flashing of deaths every day as we're being pounded with this, and especially the kids. The other thing that I would put a bookmark in, and we may want to continue this at some point, is substances along with dissociative.
Oh, yeah, that's a show in and of itself. But
I mean, so many of my people who were dissociative, the dissociative identity disorders. Sometimes alcohol would bring out some of the self parts. sometimes that would be the job of one of the alters, would be to drink and to carouse and to have fun or whatever. But there almost invariably, in my experience, there was some substance abuse somewhere in the system because the anxiety load is so high.
Well, we could do a whole show on that, and the prevalence of alcohol and PTSD, and it's really an attempt, I think, to self-medicate or run from a lot of times,
Absolutely.
depending on what you're dealing with. But if you could see that I'm shaking in my boots, I don't really have boots on or pants for that matter, but we got a massive topic next week. I'm a little scared. I'm a little intimidated. But you know what? It's time. The world is ready. Go big or go home, because we're going to talk about social media and your mental health. And you and I
You know what Freud said? He said, don't believe everything you read on the internet.
On Google. Yeah. A lot of people don't know Freud and Google, but it's true. That's where he would buy all of his cocaine, right?
I think Abe Lincoln said that too.
But we're going to talk about mental health, social media. You and I have been, mostly me, have been scratching my head trying to figure out why humans have behaved in the way that they have since, January 2020. I've had some recent epiphanies on that, and I think we'll share them. We're going to go big, go home. It's either going to be super popular or maybe possibly piss some super.
Thank you, Dr. Sylvester. Thank you very much. So everybody, 1, 2, 3, be well. See you next week.